First of all, just an introduction of me for those of you that might not know who I am. My name is Bhavik Patel. I am an estate planning attorney and a special needs planning expert in this region. I think I've given over 100 or so of these presentations to ARC family. So really appreciate being here and thanks for listening in. So Medicare and Medicaid start to talk about the caregiving, health insurance, medical expense side of these benefits, while the other benefits had to talk about a monetary amount to help support Joey. Medicare is a federal health insurance program that applies to people over a certain age, or this is the big takeaway, Joey, as long as Joey has been receiving SSDI for 2 or more years. I'm not going to specifically talk about Medicare like Medicare Part A, Part B, all of those types of things. It's way outside of the scope of what would be relevant. Plus, we'd be here forever. Just understand that Medicare is very strong health insurance. Also, take it as a solid conclusion that Medicaid is not great health insurance. And I'm purely just talking about the insurance part of it. So if I had to choose which health insurance, just for the insurance part, I would prefer Medicaid or Medicare, I am picking Medicare 10 times out of 10. There's no scenario where Medicaid health insurance is superior to Medicare. Medicare is very analogous to your group health insurance that you probably get through your employer. It's that sort of superior health insurance. However, Medicaid provides other support that's beyond traditional health insurance. And that's where the value or the power in Medicaid lies. Medicaid could pay for the nursing home or the group home or in-home care or respite care or some other form of nursing care. These are the high dollar items. A group home with full-time nursing care could easily reach $5,000 to $10,000 a month. Unless you're able to privately fund that, Medicaid is your guardian angel in that regard. It's what's going to allow for those expenses to be paid. But I would not rely on Medicaid health insurance. A person can have both Medicare and Medicaid. Medicaid will just be the payer of last resort. So Medicaid will first go look at Medicare to cover the medical expenses, and then Medicaid will take care of what it can. Actually, if Joey is on some kind of group health insurance through mom or dad's employer's health plan, they can still have Medicaid. And the cool thing about Medicaid is Medicaid might actually even pay for the copay of whatever that group health insurance plan required. So there's a lot there that you need to understand how important Medicaid is. I should have said, if you apply for SSI and you become eligible for SSI, you're going to be eligible for Medicaid. It's not going to be like, oh my God, I got denied on Medicaid, but I'm on SSI. It's just you got to remember to still apply for Medicaid. Now, you might lose Medicaid if you blow the resource test and the door gets locked. However, the door can be closed, but still unlocked, which means you're not receiving SSI payments, but you're still Medicaid. You're still receiving Medicaid benefits. And the promised land for public benefits, where you want to ultimately try to get Joey at, is having Medicaid, having Medicare, and receiving some form of SSDI payments. Forget about SSI. At the end of the day, if you can get those trifecta of public benefits, some financial need based, some not, in my opinion, that's the promised land. That's where we want to get. And then you want to make sure you don't disrupt that autopilot scenario by making sure you don't somehow lock the door inadvertently.